Watch out for these signs and symptoms in your kid. It may be quite challenging for parents to tell the difference between typical child behavior and autistic behavior. There is no simple screening for autism since children are renowned for being cranky and reclusive. Autism Spectrum Disorder is a neurodevelopmental disorder that affects communication, social interaction, and behavior. It is typically diagnosed in early childhood, but the signs and symptoms can vary widely from person to person. ASD is characterized by a range of symptoms, including social communication difficulties. This can include difficulty with nonverbal communication, such as maintaining eye contact or understanding facial expression, as well as difficulty with verbal communication, such as using and understanding language appropriately. Restricted and repetitive behaviors. This can include engaging in repetitive movements or routines, having a very strong attachment to certain objects or topics, and becoming upset when routines or patterns are disrupted. Sensory sensitivities. This can include being either overly sensitive or undersensitive to certain sensory stimuli such as light, sound, touch, or taste. Difficulty with social interaction. This can include difficulty making and maintaining friendships, difficulty understanding social cues, and difficulty with social play. Delayed or atypical development. This can include delayed language development or other developmental delays, as well as unusual or atypical patterns of development. It's important to note that the signs and symptoms of autism can vary widely, and that not everyone with autism will exhibit all of these symptoms. Diagnosis is typically made through a combination of observation, standardized assessments, and input from parents and caregivers. If you suspect that you or a loved one may have autism, it's important to speak with a healthcare professional for evaluation and support.